Good afternoon, and thank you for joining us today in this Image Challenge Livestream event from Rena Physician. My name is Mari Rodriguez, and I'll be your host today. I am a Rena specialist with Vitreoretinal Associates, and I practice in Massachusetts. I have no financial disclosures. As you know, our plan is to post an image challenge each month and then discuss the diagnosis and management using this platform. We would love to hear your thoughts online. You can find us on Facebook, LinkedIn, YouTube, and Twitter. You're also welcome to write on the chat and share your thoughts with us during this event. Today, we'll be discussing the case of a 64-year-old lady who presented to our clinic for evaluation of maculopathy. She reported trouble reading and was diagnosed by an outside provider with macular degeneration. However, as you will see, she had a different diagnosis. Her vision was 20/30 in each eye, and she had normal intraocular pressures. On examination, she had a normal anterior segment exam with a 1+ nuclear sclerosis. Examination of the posterior pole demonstrated bilateral grayish discolorations of the temporal perifoveal area and pigmentary changes in the perifoveal region in both eyes. The OCT demonstrated RPE and outer retinal disruptions, as well as cavitations that were more pronounced in the temporal regions of both eyes. At this point, we had a suspicion for macular telangiectasia, and an OCT angiography confirmed our suspicion. So if you can go to the OCTA, so here you can see telangiectatic vessels that are noted temporally to the fovea of both eyes. So given the bilateral nature of this presentation, we diagnosed her with macular telangiectasia type 2. Macular telangiectasia is a disease entity divided into three main groups. The first one, type 1, is congenital, unilateral, and is uncommon. Type 2 for two eyes, is the most common form and is the one that we described in our patient. The age of presentation is usually in the 60s, and it has a 0.1% prevalence with a slight female preponderance. So MTEL type 2 is associated with diabetes and hypertension, and some have suggested that a long-term vascular stress is one of the etiologies of the disease. Our patient also had a history of hypertension. Type 3 is a primarily occlusive disease, and it's rare. So complications of this condition involve the development of full-thickness macular holes and also the development of choroidal neovascular membranes that can be treated with anti-VEGF therapy. An Amsler grid should be provided to these patients to detect acute changes when these complications are suspected, so that they can contact the retina specialist and seek care. Currently, there are no treatments available for macular telangiectasia. Optimizations of systemic risk factors such as diabetes, hypertension, and discouraged smoking are important when counseling these patients. Again, thank you for tuning in today. You can leave us a comment online via our multiple platforms, and we would love to hear about, see you again in a month as we discuss another interesting case. Thank you.